Hi, my name is Girish Mour. Today we'll talk about something related to kidney disease, which is also called renal dysfunction or chronic kidney disease. So, when we talk about kidney dysfunction, we talk about acute kidney injury or acute renal failure. That means something happened acutely and the kidneys are not working because of the same. Let's compare to chronic kidney disease, which basically means something ongoing for a longer time, at least 3 months or so, causing kidney dysfunction. Typically, when we talk about reversible causes of kidney dysfunction or renal dysfunction, we talk about acute kidney injury. And sometimes some causes are reversible in chronic kidney disease. Typical causes of reversible kidney dysfunction is volume depletion. That means there is dehydration going on, or the blood circulation in the kidney is not adequate enough, causing kidney dysfunction. We can also think about medications like pain medications, which belongs to NSAID class of medication, like ibuprofen, naproxen, like medications. Sometimes kidney can be obstructed from below, like the ureters, because of kidney stones, bladder issues with somebody with prostate enlargement. Sometimes patient with diabetes can develop neurogenic bladder, where the nerves to the bladder are damaged and the patient is not able to empty the bladder completely. There are some causes of kidney dysfunction related to kidney itself. That is typically we think about glomerulonephritis, like lupus nephritis. Sometimes can be reversible, sometimes cannot be reversible. Patients with IgA nephropathy, there are other glomerulonephritis like ANCA vasculitis can fall into this category. To decide a particular cause of kidney dysfunction, which is reversible or not reversible, we first have to look at what causes kidney dysfunction, and then hopefully we can find the reason, and then we can then treat the reason like NSAID class of medications or dehydration to see if there's any reversibility. However, there comes a point where the kidney is damaged significantly and it's irreversible kidney damage. It does not matter what the cause of the initial insult may be. Coming to our next topic, looking at patients with diabetes and kidney disease. Typically, diabetes is a long-term damage to the kidneys, and one of the major issues with diabetes is controlling diabetes. That means having a good hemoglobin A1C or 7, around 7. When diabetes have caused kidney disease, typically that's chronic kidney disease. Your kidney function, as we call it, GFR is less than 60, and that falls in stage 3 kidney disease. We still want to control diabetes very well. They can develop proteinuria or leakage of proteins in the urine. We can give medication like ACE inhibitor or ARB to help with the decrease in leakage of proteins. We also control the blood pressure as they go hand in hand with diabetes. And sometimes, as I mentioned, diabetes can cause neurogenic bladder. That means the nerves to the bladder may be damaged, causing bladder not to empty. And we may have to do self-catheterization at that time. Diabetes in general can be a chronic progressive disease once it develops proteinuria, but we can still do a good job in terms of managing diabetes, control better hypertension control, and cholesterol control. We think of complications from kidney disease itself, like calcium mineral metabolism. Typically, as we develop kidney dysfunction, chronic kidney disease, your calcium can go down, your phosphorus can go up, your vitamin D levels may be low, and your parathyroid hormone, called the PTH, can go up too because of these imbalances. Once we start developing kidney dysfunction, we look at the calcium levels, the phosphorus levels, the parathyroid levels, and the vitamin D levels. Typically, we want to keep the phosphorus level less than 5 or 4.5 in somebody with chronic dysfunction. Somebody on dialysis, typically the target is less than 5.5, and calcium, usually we try to target between 8 to 9 range. If their vitamin D levels are low, we try to give them vitamin D supplementations to get to a level of 30 or so. Parathyroid hormone, it's changed over the last decade or so. And we like to keep the parathyroid hormone level if they're chronic disease in a reasonable range where it does not cause calcium to go up. So these are basically some basic information on kidney dysfunction. Thank you.